Okay, welcome everyone. My name is Celine Coggins. I'm the Executive Director of Grantmakers for Education. We're just about ready to get underway with our webinar this afternoon. If you are here, you should know this is the unique challenges of supporting the early childhood sector through COVID-19. We know that for so many of you, this is a very complex moment. We're inviting you to a conversation that is formative in nature. We're all trying to figure out the best strategies to support those in the early childhood workforce and the students and families that are encountering incredible challenges right now. We're really excited about the level of participation on this call today. We had about 130 people sign up, which I think is really heartening in this moment. I want to say a couple of things about GFE as an organization. We see ourselves as a connector in this space. So we have almost 300 members in the grant making space, many of whom are focused on early childhood education and many of whom are focused on the grade levels beyond that. And we also see ourselves as an information source. So right now we're in the space of trying to piece together the information that we do have. We have a wonderful panel today. What I invite you to do is add your questions in the chat box at the bottom as things come up for you. I'll be the moderator and be kind of circling back and posing those questions to the panel. We will later on allow you to go off mute and ask questions yourself as well, but we want this to kind of meet your needs. So what I'd like to do now is turn things over to Shannon Rudisill from the Early Childhood Funders Collaborative. She's going to introduce our panel. They'll speak for maybe half of the session, maybe a little bit less, and then we're going to open it up to your questions and comments. So thank you so much for joining us, and Shannon, take it away.
Thank you, and I just want to thank you, Celine, and GFE colleagues for making this platform available and working with us on this, and also for pointing out that this is a formative conversation, because I know everybody recognizes how quickly things are moving. So by way of introductory comments, I think I want to say that one of the things that has been really clear in less than a week now is that the early childhood education, childcare, and I would say also paid family leave implications of this crisis are very profound. And I'm seeing folks that I recognize here, and I know some of you are very, very steeped in early childhood and what it looks like, and others maybe less so. So I think this will be a good balance of context setting for what the early childhood world looks like, with some information for those of you who are really familiar with that about what we're hearing right now and what we think our best responses would be. Some of the things to keep in mind and that we're going to hear from our speakers about, especially Rian, is that unlike K-12 schools, we have in early childhood a large variety of providers and institutions providing this, and public funding is only the tiniest, a small fraction of the funding. So unlike in K-12 schools, where at least for some portion of time, funding is going to continue flowing, things are much more precarious in the early childhood world. And in fact, at the same time, there's a big recognition of the need for essential workers. There's a tremendous amount of pressure to provide care for healthcare workers and others. So there's some very unique things happening in that space. We've had a couple of guiding principles that we put out, and I'll talk more about them in a minute, but I want to call out two before I introduce our speakers, because I think that they underscore what we're hoping to do on the call today. One of our first guiding principles is to listen to grantees and direct providers on the ground and families, because we're hearing a lot of information like people's businesses aren't going to make it, or childcare is not going to make it, or families are, going to struggle to pay rent. And it's going to be really important to listen to people about what they actually need to ameliorate those conditions, because it would be easy to make assumptions that wouldn't end up being the most effective. So, and that's one reason we're really happy to have Rian here to describe what we know a few days in about that landscape. And then the other one is to work in a way that public and private sector investments can work together in really useful and complementary ways, and to not lose sight of public investments in advocacy along with direct response. And in that regard, Barbara could not be, we couldn't have a better person to talk to that than Barbara. So I'm really happy that Barbara's joined us. So quickly, I'll give a thumbnail sketch bio of the two speakers and then turn it over to Rian to get us started. Rian Evans-Alvin is the Executive Director of the National Association for the Education of Young Children. She's been there for nearly 7 years. They're on the forefront. They're the largest membership association of early childhood professionals and have been working tirelessly both on advocacy and on listening directly to providers on the ground. And before taking that job, Rian was the architect of Arizona's First Things First initiative, for those of you out west, which invested $130 million every year in tobacco tax money into Birth to 5 health and development and learning. And I just happened to notice, I didn't know this, so I looked up today. She also has some philanthropy experience, having previously been a senior leader at Arizona Community Foundation. Barbara Chow is probably very familiar to this audience, the Education Director of Heising-Simons Foundation, previously the Executive Director, or the Education Director of the William and Flora Hewlett Foundation. But part of what makes her so well prepared to talk about this, she's been a real leader for us on this already, and she has extensive national policy background, both in the legislative branch and the executive branch, in senior positions with budget and domestic policy. So with that, I don't want to take up more time. I want to start, Rian, with talking to us a little bit about the context of ECE and what you're hearing and any implications you think that has for private funding.
Great, thank you. Can you hear me okay? Are you there?
Yes, yes.
Okay. I've been having, I think at 2 o'clock, our entire neighborhood gets on Wi-Fi, so I've been having some technology issues as of late. But it's great to be with all of you, and I appreciate the opportunity. And as folks have said, this is an evolving situation. Every 24 hours, something is different. I want to talk a little bit just to orient you to the landscape, and then I think it's really important to the ongoing landscape of early childhood education lends to the story that's happening right now. So early childhood education, like Shannon said, very different than K-12 in that it is primarily a private system. There are about 100,000 centers and programs in the country. There are another 200,000 licensed family care providers. And there are about 2 million educators in the workforce. That is about 1 million that are in programs, so private and public centers, faith-based centers, Head Start schools, and another 1 million that are running family child care. That does not account for probably what is estimated to be 2 million more people who are quote unquote off the grid in family child care that is not licensed or regulated. So think of kith and kin care and that sort of thing. The marketplace is primarily really a small business. So 90% of the 100,000 programs that are licensed and regulated are one site centers. So it's the mom and pop, it's the mama bears, it's the one center in one place. And so only at this point, only about 10% of the market are large scale system providers. And as you know, or maybe I would presume some of you know, the economics of early childhood education without a global pandemic is incredibly fragile. The ratios that you have to maintain to offer high quality care are such that margins are really, really thin. I mean, you think about what you pay for a educator for a salary, and then what kind of revenue you're getting in for fees. We've been debating this the last few days in terms of what percentage of families are private pay, which means I walk into a program and I say, here's my money, here's my child, and I'm the full payer, and what percent are government paid. That's tricky to tell, but really important to the story related to the COVID outbreak in that. So with private providers, many programs If I'm the private pay parent, I get a slot for my child. While I'm working, I pay for that slot. Some providers require me to pay for enrollment. Other providers, I pay for attendance. So if I'm only going to send my child there Mondays and Thursdays, and then the following week I decide to take off from work and I'm not going to send him at all, then I only pay for what is attendance. And so some of the larger, more sophisticated providers require enrollment. Others pay for attendance. So that's a percentage of the system is fully this private-based mechanism. The other part of the system is government subsidized, and that is the place that we've had some big wins recently in terms of subsidized funding. 40% increase in the Child Care Development Block Grant over the last 2 years, plus more money for this year. But with subsidy, if states are in full compliance with federal subsidy, then they pay based on enrollment, and it's typically a 12-month enrollment period. So if I qualify for subsidy and I take my child to care, then I'm enrolled for a 12-month period, whether I'm there Tuesday and Thursday or not. The problem with that is that if there's a set of whatever the number is, a consecutive days in a row that I don't have my child's absent, I run the risk of losing my slot that is subsidized by the government. So, as you can imagine, from a provider perspective, I'm juggling. I've got this whole system around private pay parents. I've got this whole system around subsidized kids. I'm juggling the nuances of it. Some of it's regulated by the state. Some of it I get to decide. And the other thing on subsidized kids that's really, really profound is that most states, again, pre-crisis, are not paying what the full cost of care is. They have gotten better with the increases that have happened over the last 2 years. But in general, if I get, I'm making this up, if I get $20,000 from the private provider, I'm typically getting a fraction of that from government funding, from subsidy. And so a lot of programs won't even take government subsidized kids. That has gotten better, and states have pushed over the last 2 years to pay what we call market rate, which is what at least a higher portion of the cost of care is. So the impact for teachers on that, if you can imagine in the fragile economics of no guarantee of money and this kind of inflow outflow that is very unpredictable in best of circumstances, you then have early childhood educators who, in many instances, don't have retirement. They don't have health insurance. They don't have a full benefits package. They're, on average are making $10.40 an hour, which qualifies 46% of the early childhood workforce to be on some form of government assistance. So that is what happens on a normal day. And we spend a lot of time saying the fundamental economics of early childhood education have to evolve. So imagine now in walks COVID, and you have families dropping out. You have providers with no margins from a financing perspective. You have families at the same time, folks being deemed essential, so you stay open for some families. And so it has put this marketplace into absolute chaos. And as Shannon said, it evolves every day. We know that I just got off the phone with a large-scale national provider who told me that on Monday, 70% of the fee-paying parents were there. On Tuesday, 65% of the fee-paying parents were there. Yesterday, it was 50. Today, it's 40. They're expecting it probably to go down to 38%. They have worked out a deal with the state governments that they're working with where if I'm going to use the word furlough, but I don't think that was the term that they used, but basically furlough half their workforce. They'll keep them on staff in essence, so they're not unemployed. The state will pay for half their wages through unemployment. And then this provider has agreed to continue to pick up their health insurance. And again, this is a huge provider. They have funding through April to be able to pick up. They think they can afford to pick up through April their health insurance, at which point they won't. We also saw in the headlines yesterday, Bright Horizons, which is 20,000 early childhood educators work for Bright Horizons. They are almost immediately shuttering 50% of their centers, which means that 50% of, so 10,000 early educators are about to transition from being employed to being on unemployment. And again, these are the big dogs in the space, which makes up a teensy tiny percentage of the space. The vast majority of them are mom and pop childcare. A lot of the nonprofits have followed the guidelines of schools, which Macy is recommending actually from a public health perspective that programs first close and then the government step in to systematically reopen them as needed and to be located near essential services for communities. But I will tell you, and this is no slight on all my colleagues working in state government, what I've observed over the last few days is a government that is wholly unprepared. You know, if this was a FEMA crisis, they'd be prepared. This is a HHS crisis. And from a public health perspective, there have been no operational scenarios on how to do this. And they are scrambling and everybody is making it up as they go, which makes it incredibly complicated. So on the one hand, families are saying, I'm keeping my kids home and therefore it's decimating the industry. On the other hand, the government's saying, we need you to stay open, at least for a certain percentage of families for essential employment. As Shannon said, we just decided very quickly last Thursday for any of you who are researchers, you'd be horrified at how we did this. This is not a research-based survey, but we decided last Thursday to stand up a survey just to get stories from the field and a sense of what's happening that we've been pitching to media all over the country. So in a week, we have 9,000 folks who've responded to the survey. And so we're constantly analyzing that and pushing new data out. But it's a grim story that we're hearing back. 60% of providers will close in 2 weeks if they don't get some sort of subsidy or money or help to stay open, to continue to meet payroll. And in most instances, if not all, payroll and related expenses are the biggest costs. I mean, that's when they say not able to survive. It means laying people off. It means that they won't be able to pay their staff. We have talked and I've been able to push out some information on like small business loans and mortgage forgiveness kinds of things to help them with the physical plant. I'm slightly more optimistic about the physical plant piece of all of this and maintaining the physical infrastructure. But what this will do to the workforce and the ability to maintain payroll is absolutely, I can't even begin to describe the magnitude at which it will have an impact on this workforce. So I'll leave it there. I'm happy to answer any questions or chime in as requested.
Thanks. I think that was really helpful just to set the context for what it's like on a normal day. And then I imagine there's a lot of questions that people will have. But I think before we go to questions, Barbara, so you have thought very hard about how to make some order in your investment strategy out of what is a complicated but also swiftly moving landscape. So I think it would be, really helpful for folks to hear from you, because we want to be able to have some ways of thinking about how we frame a response, even knowing it's going to be a complicated and swiftly moving landscape.
Yeah, thank you, Shannon. So we have been, I think with Shannon's first stricture, listening hard, hearing these very, very difficult things from our grantees and from the field at large. And so I've been thinking a lot about where is philanthropy's unique assets and what is it that we can do that, can be responsive to what is an overwhelming need right now. And I think there are kind of four things that we can do that we are uniquely suited to do. One is we can move very quickly. The public sector is acting, but we can move more quickly. Second, we can maintain our equity focus, which I think many of us share and believe in. Third, we understand, I think, and have a reasonably good grasp of the nonprofit sector itself. We know who the strong actors are. We know who we can depend upon. And fourth, we can fill in gaps where the public sector is not responding for some reason. And maybe just a word on that. Right now, as we speak, the Congress has already passed one stimulus bill Another one is on the way. It could include very significant economic relief. There are also at the same time emergency funds being stood up all over the place. And I think there's sort of a collision of timing that we're just going to have to be conscious of, that we're not, duplicating isn't even the right word because our clients with these dollars are so small, but that we are not doing something that ultimately the public sector is going to sort of engage in. If I've thought about that, there are kind of two exceptions, I'd say. There's many of us are working locally, and that seems completely appropriate. And there are, again, gaps. There are groups that will not be covered by any of these stimulus bills, probably. For example, undocumented families may not get, are unlikely to get a check. I think that's kind of the way that I've been thinking about how one provides economic relief in the middle of all of this. So bottom line, I think we, like many of you, have thought that we really need to mobilize our resources very quickly and to get as much as we possibly can out right now. That said, I am also of kind of the belief that there will be a second round, that if we put every sort of dollar we have at the door right now, there are things that will happen in a month or 2 months that we don't even know what they are because the world is changing so rapidly that we're going to have to kind of paradoxically both move money out quickly and hold some back for a second round. At least that's how I've been thinking about that. So to kind of like give us some order or some way of prioritizing or thinking about this, there are kind of three big buckets that we've thought about as we think about our grant making. The first really is around supporting grantees who are experiencing financial hardship. It started out with just many of them had events or conferences that got postponed, but there are many things beyond that, and really enabling a very adaptive, rapid response to changing circumstances. So I think like many of you, we're trying to relax grant requirements. We've set up a rapid response fund for grantees experiencing financial hardship. We're trying to shift for example, one of the ideas that we're experimenting with right now is shifting almost everything we can to general support grants, even though, for example, we're now an early childhood funder and there may be grantees who are working across the board, maybe working in K-12 or beyond that. So we're thinking a lot about that. We're trying to waive as much as we possibly can in terms of reporting requirements or over the next few months, again, as everybody's working from remotely or in, dealing with personal issues and organizational issues, we're thinking a lot about how can we just make their lives, as easy as we possibly can. So there's kind of a bucket around just our existing grantees. The second is, I would call field support. So many of our grantees they have been doing an incredible job, I would say, in the early childhood field of working together, working swiftly, working around the clock. But they are kind of reaching their capacity limits. So we're trying to get funding out in about 4 or 5 different categories. One is policy advocacy. They are, again, we have a lot of federal grantees that are on the Hill right now, and I'm joined by my colleague, Rebecca Gomez, who is somewhere in here, who could speak more about that, but we're trying to get, they are all kind of working to the max right now. We're trying to sort of help them. So we've actually already made 5 grants in the last 2 days to several of them. Another large bucket is communications. For example, the CDC guidance is translated in other languages, but it's very hard to understand. It's not family friendly. So we're trying to figure out how can we take this difficult to understand information and make it available through trusted messengers through some of our existing grantees. So there's kind of a communications bucket. Technical assistance. At some point, the early childhood field in particular is incredibly complicated and bureaucratic and has many different funding streams. So understanding what HHS or other departments are doing and how that translates into practical information for providers is sort of another bucket, a little bit more medium term than near term. Another bucket is around professional development, online learning. That is really, I know that it's something that the K-12 funders are thinking a lot about right now as so many schools have shut. It's a little bit hard to wrap your head around what that means for early childhood, but kind of there's a piece around that. And the last is around data and research needs. So there's a lot of data. Macy did this amazing job very quickly. They're answering questions that the Hill is asking like 20 times a day right now, or maybe 50 times a day. They want to know, where is the impact, what states is it in, what do they need to do, and so forth. So there's a huge, huge need for some data to underpin that, as opposed to kind of, more anecdotal information, although that can help as well. So that's our second broad bucket. And the third is around kind of emergency response for vulnerable populations. We know there are a lot of low-wage families. We know that the early childhood workforce itself fits into that bucket, that are really feeling enormous economic stress right now. And so we are looking for, this is a little bit tricky, because I think on the one hand, we know that there are folks struggling right now, and we want to, I think our hearts go out to them, and we want to try to get our resources out quickly. I think the question of how that intersects with the public sector response is something that we just have to think through pretty carefully, because we don't want to, again, do something, create there are any kind of number of emergency relief funds that are trying to support low-wage workers. Some of that, again, may be picked up by this next stimulus bill that's coming through, or picked up at some other level. So I've been thinking a lot about the importance of just really working through large intermediaries that have very strong local chapters and understand what those local needs are. And we've been kind of considering a few of those. The National Domestic Workers Alliance, for example, has stood up a coronavirus emergency fund. If anyone has an interest in that, domestic workers, they have 280,000 members, and they're among the first and hardest hit. We're also thinking a lot about the family childcare providers who don't have a lot of margins, again, are probably among the childcare industry. And you can correct me if I'm wrong, but I think some of the most fragile in terms of their ability to sustain themselves. There are a lot of grandparents in that group, and there's a kind of a complicated message right now to early childhood providers about whether or not the grandparents should be taking care of them, because they're the most at-risk population. So there's a lot of kind of really, really difficult choices that families are making right now, and anything we can do at all to try to be helpful with that piece of it is something that we're involved with. And maybe the last is that we're a Bay Area based foundation, so we're also looking very much in our own backyard at what kind of a local response makes sense. So those are the kind of big three buckets that I've been thinking about.
Thanks. And I think I'm going to say a few things about how ECFC is thinking of going forward. And I think we want folks to put in the chat box, right? Selena and I haven't seen anything on mine. So while I'm talking, I'll say a couple more words to give people a chance to start chatting questions.
Yes, I have tons of questions, but I would like to actually hear questions from the folks who are on the call. So throw them in there, and I will make sure we try to get to all of them.
So one thing, ECFC, we have now put up our COVID response page on our website, and we're trying to be modest in what we're curating for people, because everybody's got a website. I'll say a few things we have up there. We have guiding principles and advice, more or less, for early childhood philanthropic response. And I think it gets to some of the things that we've been talking about, which is being mindful of the public investments, really advocacy. There's going to be no better way to put money in people's pockets than trying to get unemployment to cover more people, right? And food by SNAP and child nutrition programs expanding. So we don't want people to pull back on that. I just got off, but I won't digress on this call, a fascinating call briefing us on where we are with paid leave right now and the advocacy opportunities around paid leave. So that's another example. So guiding principles about how we should think about it. We'll keep changing and evolving those. Emerging opportunities, some of those Barbara mentioned. We're starting to, if you have thoughts about other emerging opportunities, which is not everything in the world, but this is a thing that public funds are not likely to go to. This is where private money could flow. We want to aggregate those for people. And, you know, right now we have things on there about home-based care, about advocacy around equity in the public investment response, about emergency childcare, which a lot of our funders are asking about, and that makes some sense, but I think eventually that may be a public response. I think more states are getting into it, so we're watching that. I anticipate by next week we're going to work with Grantmakers concerned with immigrants and refugees to put, like, what are they thinking about immigrant, refugee children and families, and I personally have on my mind a lot of kids in very stressed out families that are now off the grid at home with nobody kind of there to provide support. And I think this goes to K-12 too, for K-12 funders. We're going to have increasing rates of child abuse and neglect and increasing rates of domestic violence that happens in every disaster and every economic downturn, but now everybody's at home and there's no support. So are we going to be able to use home visitors in our early childhood space, early childhood teachers, and maybe regular teachers and school counselors to start to respond to that? If any of y'all are working on that, if you're working on the K-12, I would love to talk about how private philanthropy can join into that. We also we're going to put some modest number of resources on our page because everybody has a million links. We're going to try to facilitate sharing calls between funders, both peer funding, peers, and then to occasionally invite experts like Rhian today. And then we're thinking about trying to map out investment responses that people are making, but obviously it's moving really fast. So that's some of what we're working on, and I see questions have popped up. So
yes, and one, Shannon, is related to the topic you were just starting to talk about, so I'll invite all of the panelists. Just this question of the impact on immigrants, children, and families, as well as the undocumented population and how folks are thinking about that.
You know, just one piece of, I think it's good news, is that the stimulus bill that was just signed into law, I believe today, does include free testing for everyone, and I think that extends to everyone. That, you know, wasn't explicit in the legislation as it was moving through Congress, but the Shannon or Rhian, correct me if I'm wrong, but that is that's one small piece of good news. It's probably the only thing that's escaped the public charge rule, which has been, you know, the rule that sort of made it very difficult for undocumented families to access benefits. But there are starting to be funds emerging to help with economic relief for undocumented families, because again, they are unlikely to get it through the kind of existing mechanisms.
Yeah, Mrs. Rhian, I would just echo what Barbara said and say, you know, that's a population that is already in large part living in the shadows, and so this will worsen that for sure. On the one hand, there's stability in some of the ways undocumented families access early learning. I mean, and you think about like a migrant Head Start and that sort of thing. The problem is that most of those types of programs, rightfully so, have for public health reasons closed down. So for a problem that already exists with individuals in the shadows, this will exacerbate it. And Barbara's right, there is money, and I mean, public charge is just it's a disaster. And so there is, yes, there is relief, but they will be hit harder than most. And I don't know, I have to think about if there's a strategy that's a tough one.
Rhian, you talked about your survey and having 9,000 respondents in the early childhood space. You mentioned the 60% of providers anticipating that they would need to close in 2 weeks without a change. Could you share a little bit more from the survey?
Sure. And we have that data, by the way, by state. And so if any of you, we've been getting that out to state system leaders. So if any of you are interested in a particular state and want to see that data, Lauren's team could definitely get that to you. So yes, so the 60% of them say they could not afford to stay open for 2 weeks without any kind of fee payment, either government fee payment or private pay fee payment. as Barbara mentioned, it was about a third were center-based and about 2/3 were family childcare. Family childcare. I mean, it's family childcare. I guess maybe to some degree, good news, bad news. Is the bad news is they are absolutely more vulnerable. When you think about running a business, and there are no margins, it's in their home. It's not as if they have huge reserves sitting, somewhere. And so they are more vulnerable more immediately. I guess what I would say on just in thinking particularly about how philanthropy over time could invest, standing family childcare back up after a crisis like this will be more expedient than what it'll be to stand centers back up. Because if you don't have employees, you're just more nimble with family childcare. So there might be an opportunity there. And we're too much in the middle of the crisis right now to really lean into this, but I do think that this is a moment to capitalize on some measures to fundamentally address the economics of early childhood education, and really talk about those vulnerabilities. So we're talking about how do we use chambers and media to be able to do that. But yes, family childcare is. The other thing that I think is important in the survey is that it isn't a temporary closure. They're talking about permanent closures. So there was finality in how they were describing their situation. Particularly again, small businesses, no mortgage relief, having to foreclose. This isn't something then you just hop on and restart again 2 months from now. It is altering, it's fundamentally going to alter the landscape of the delivery of services in childcare.
And I would just add to that, Rian, and I need to dive in a little more to some of what's been crossing the listservs today about policy. I've worked extensively on early care and education during disasters, like geographically concentrated disasters like Sandy or tornadoes in Joplin, Missouri. And one of the things that has consistently happened in government response is childcare consistently totally falls through the cracks because you have two sorts of public responses even in what now seem to be relatively concentrated disasters compared to this. You have one set of responses for like schools and nonprofits and people that are like recognized to be providing public good, and they tend to get grants, right? And states can give grants and get reimbursement. And then you have another set of responses for small business that flows from the Small Business Administration and is generally loans. The problem is childcare is extremely precarious in the best of circumstances, and loans are not necessarily the best. They're not necessarily loan worthy. They're not necessarily able to pay back loans. They not necessarily want to take on loans. And if you're, for example, running a family childcare in an apartment building, right? Like that might not be a business that is going to be very eligible for a loan, right? So low-income communities get disproportionately hit, right? Because a lot of it looks like people in low-income apartment buildings offering care. And so that's one thing that has made it, and I think as we move through to the standing back up point, I have seen some people talking about small business grants because the magnitude of this is so large. And I think that will be interesting. And I think there is something there for private philanthropy, especially folks who are working in local communities. As you think about your local early care and education community and what you want to do, there are people who've worked on this. They know how to think about grants versus loans. They know how to think about business technical assistance for people. That is something that has been a long-standing strand in early childhood, and I think that we could also, as an offer from us at ECFC, we would be happy to connect you to experts in all those areas.
That's very helpful. So we have a question that will open things up to anyone who's willing to share kind of where they are. This actually was a question that I was going to pose to Barbara, but now it's come from our audience. So this question of the balance of rapid response dollars versus support to existing grantees. So I'd like to hear more from others on their thinking related to the balance of funding allocations as it relates to the creation of set-aside dollars for rapid response versus continuing support to existing grantees through the crisis. So long-term versus shorter term, our longer-term priorities around expanding the quality of early education in our community and improving kindergarten readiness, and then the set aside dollars for this crisis. And then the corollary effects that we know are going to happen, like child abuse, neglect, and domestic violence. So how do we balance?
I'm happy to, Celine, I'm happy to start off on that process because I have no idea if this is the right idea or not, but we put about half into the kind of emergency relief funds and about half into the kind of grantee and field support bucket. And I'm also thinking that we probably need to put sort of half of our COVID-19 response out in the next few weeks and about half of it in September. So that's sort of how I've thought about this. I, again, don't know if that's right. Emergency relief just is overwhelming because it's so present, but it's the sort of seed corn that we have to kind of maintain as well, and that's probably the other part of it.
And Barbara, this is Rebecca. Could I also jump in to add to what you said?
Absolutely.
Hi, everyone. This is Rebecca Gomez. I'm a program officer with the Heising-Simons Foundation, working with Barbara on her team. And the other thing, I agree with everything she said. The other thing I want to sort of add around that question of like rapid response versus strategy is that for the early childhood field, there is, you know, this extreme short-term work, right, to deal with what is a demand shock, which will become a supply shock, as Rhea, Shannon, and Barbara have all alluded to, because businesses will perhaps not be able to survive this, and then people will go back to work and need childcare. And then there's sort of like the medium and long-term policy work, which our advocates and grassroots organizers had already been working on, right? So if you think of this as, for those of you who fund advocacy and organizing, or who want to fund advocacy and organizing as a part of a broader strategy, you can think of this as a policy window, right, to do some really good short-term work to help get these stimulus packages out in a way that really nourishes the early childhood community, which is structurally unstable, and then start supporting grantees to pivot to a longer-term strategic set of work, which again, they're already engaged in, but now have a super activated populace who's just been through, you know, pandemic with family suffering. So I think that's another way to think about this in terms of balancing rapid response and strategy. There's a lot of this that I think we could parlay into hopefully really good structural change field and for kids and families at large.
I'm going to leave a minute of wait time to see if anyone else would like to share how they're thinking about the balance of existing grantees and rapid response. I'm always an impatient teacher. So I will pose another question. I do want to continue to encourage you all to throw things in the chat box, and I will get to those. You all are interesting. Yesterday, I was so on my toes. I had a million questions in the chat box. Today, a different story, so bring them on. But I would love to hear a little bit more about this advocacy question. So there are a lot of things right in this moment that advocates could focus on. It could be the stimulus as it is. It could be specific pieces of it. It could be the larger, longer term agenda. How are you thinking about policy and advocacy in this moment where it's clearly a priority, but there are lots of ways that it could go?
Brian, I think you should start with that, because I know there's several consensus letters that have gone forward to Congress, and there's one that's just emerged from state advocates, which I'll write a note that we'll send those letters around in the post too. So, but maybe you should describe a little bit about that.
Absolutely. So a couple of things. I sent ahead of time, I don't know if it went out, NACI put out a statement on Sunday. I think, so to Barbara's point, the biggest thing that the federal government can do is put a lot of money into the system right now that is
and loosen strings, not regulatory and licensing strings, but loosening strings on eligibility and how families can access that money and who's eligible for that money and how states get it to the right families. Simultaneous to that, states have to get incredibly coordinated about how they're doing this. I mean, and it is all over the map right now. And again, not to be judgy, I don't mean it this way, but that way, but it is really worrisome to me how all over the map it is, and how, I mean, this field hasn't practiced for this. We haven't practiced for it. So once the money gets there, it is absolutely essential in any kind of crisis. And you look at this with like hurricanes and that sort of thing, you centralize and coordinate communication. And states are not doing that with childcare. Some states are, most of them are not. I mean, there needs to be almost like a command center set up where the head of early childhood in the state has great authority and control. And as programs are shutting down, they need to, by zip code, make sure that they're keeping a certain number of programs open, that they're licensed and regulated, and that to the extent that CC and R&Rs have the capacity, that they are, or that there's an 800 number set up, that there's one channel by which families are accessing questions around money and accessibility of childcare. And that is not happening right now. Again, we're back at what's essential, what's not essential. Like, that's been the big discussion of the day, is who they're trying to figure out how you define essential. And in the meantime, you've got, a lot of chaos. So there is a letter, as Shannon mentioned, that we're organizing for all states to sign on, that's going to the Hill. Behind the scenes, we are working on a very specific economic stimulus bailout ask for early learning. NACY's working on that with First 5 Years Fund and the Bipartisan Policy Center in particular, where we're saying we are quantifying the economic hit that is going to happen to this field, and we need this money now, as I said earlier. And to the extent that philanthropy can support that, I think it would be really helpful. We also just need to elevate. I think we've gotten much better over the last couple of weeks. I've seen a number of stories about childcare. One of the credentialed press folks in the presidential briefing yesterday actually asked about childcare. So I do know it's on folks' radar screen, but the more philanthropy can just call, I know you can't do direct advocacy, but to the extent that your senators know how immediate this crisis is and substantial. One of the things we were talking about today was, could you, in an immediate package, just get money to providers specifically for payroll? Like, that's the biggest thing right now. If your center's closed, we will pay your payroll for you. So those are some of the things that we're doing related to policy and advocacy. But we do think that there's got to be a quantifiable, this is the economic hit that the marketplace has taken, and what we need to be able to sustain any kind of an industry in the next 2 months and over the next 6 months. So any support on that from philanthropy would be really helpful.
Yeah, I would add to that
provide information.
Pardon?
Okay, Shannon, do you want to say something?
I'd let Barbara go first.
Okay.
I was just going to say that.
Go ahead.
Yes, I was just going to say that there are, I think the most immediate, we have to triage this a little bit, right, when we think about the policy response. So there is what is happening right now is this large economic relief package that's being debated. That, I think there's a good chance that'll go in the next week or 2 weeks. So if you're able to your grantees are able to get engaged with that and make sure that low-income workers are getting what they need and so forth, that is kind of the first tranche. Just by way of comparison, in 2008, I happened to work on the stimulus, I was on the Obama transition team, and it was about an $800 billion package. This is they're talking about a $1 trillion package, but it will probably not be the last one. There will be another train in the next, it may be more industry specific. There may be opportunities for both K-12, early childhood, and others to sort of think that through. When these things move, my only kind of thought is they move really fast. And so the more that you're kind of prepared for them, the more that you can kind of think as big as you can to both achieve these long-term structural wins at the same time you're dealing with an immediate crisis. I know that's a little bit hard to do. It feels to me like that is the thing that I would really focus on right now.
This is Rian. I just want to add one more thing that I think it's really important to reinforce that it is not the best policy move to loosen licensing and stand up makeshift childcare under the guise of essential employees. There's a better way to do it, to both acknowledge that there is a percentage of the workforce that is essential, and there's a systematic way to do this that is using current licensed regulated childcare in a systematic way to support the workforce that does need childcare. One example is to loosen the restrictions to allow more school-age children into a program that's licensed for birth to 5. That would be okay as long as the center is equipped. But just to say, I've seen so many examples in the last 48 hours of hospital systems getting the green light for unlicensed, unregulated care to be on their campus. Well, number one, the last place you want a new childcare center in a pandemic is on a hospital campus. There are, in almost every hospital situation, there are licensed, regulated providers that are shuttering, where childcare employees are going on unemployment, where if you did it systematically, you could take advantage of those spots for essential employees. So to the extent that we are discouraging kind of reckless, quote unquote, emergency behavior and not systematically doing this in a way that keeps the current system stable, but also supports those families that do actually need essential care, to the extent philanthropy can influence that, it would be great.
And I just want to call out, there was a question in the chat box that, and I think I want to clear it up because I think it was, so the question is, was that a request just now, I think from you, Rian, for philanthropy to cover immediate payroll support while waiting for government relief? I don't think so. I think the question was about advocacy, and you were talking about what you would like to see in economic stimulus bills, but I want to give you a chance to clarify just what you were saying.
Yeah. So I think, to Barbara's point, I think ultimately at the scale that it needs to happen, the economic stimulus bill is going to be in a better place to do that. That said, I would never presume to understand all the complexity of your grant making. If there are programs in communities, particularly nonprofit programs, that can't meet payroll, yes. If government's going to be slow for the speed at which we need this. And so if there's stopgap measures, yes, absolutely. If that's within your wheelhouse and within what your organization can do, it in terms of checking the box for need, it's a huge check mark.
So one recommendation, I had somebody call me about this yesterday, Rian, and so I ventured a recommendation. So now with 85 people listening, you can tell me, was this a good recommendation or not? Somebody called me with a similar kind of question, and what I said, and actually they kind of immediately jumped to, and I won't call it out, but I know X provider in my community, they're probably hurting. And it was a provider that's 100% government supported and really well known in the community. And I would never say not to fund that provider, but I think it's important to know that, if you were providing public pre-K, and I think education funders will know, they might have money through the end of the year. I don't think they're pulling back money. Or if your Head Start grant was there, it might be going through the end of the year. So my recommendation in terms of targeting was to look for your local child care resource and referral agency, or look for your local affiliate of the Association for the Education of Young Children. Look for somebody who knows the local market, because I feel like in every local market, there are going to be a few providers that are known to be pillars that, if we want anybody standing at the end of this, we want it to be these folks. And that somebody who really knows the local market will know a little more about, but they're going to have their grant for the next 2 months. They'll be okay. This family childcare provider, is going to go out. Is that what you would recommend, Rian?
Absolutely, and I think it's great advice. And different circumstances for different providers. Like, so maybe one is saying, I'm in an area where I am a one-site provider. I have enough quote unquote essential folks who I'm keeping my childcare open at a decent rate, but gosh, the mortgage payment could get covered, or my rent for a month or two would be really helpful. We are scrambling for the first time. NACI typically does not raise money this way. We usually say for disaster, like go to Save the Children, but we actually are doing a solicitation to do exactly what you said, Shannon. We're going to set up guardrails around specific criteria and then push money out to our affiliates to grant money in local communities, because they are going to know better. Whether if you're a public pre-K, you're going to be okay likely, because your money is based on enrollment, not attendance, and it's guaranteed through the year. Not the case for programs that are more funded through traditional childcare. And the big thing too is with middle income families, the middle class in many ways subsidizes the system, and the lack of stability for childcare because of full fee paying families is going to be an enormous problem. Families pay upwards of what it costs for college tuition for childcare. They're immediately pulling out, as I gave you that example of 70%, 50%. And so a lot of this is not who we would traditionally think of the most vulnerable, but stabilizing providers who provide to the middle class. If you're looking at this from an economic stability perspective, that may be the most important, and the providers that are based on fees may be the most vulnerably hit.
That's helpful. We got a couple more, and Barbara, I was wondering if you mentioned the National Domestic Workers Fund, like if that's another place where people might look. We had a comment in the chat box about concern in rural areas about not having the supports that are needed. If anyone has anything to comment on there.
About rural areas specifically, I mean, the national, if anyone's interested, let's just put it that way, on the National Domestic Alliance, then, I'm happy to chat. And Ai-jen Koo is the one who runs that. I think maybe one point that was emerging from this that I was thinking about is that I was a national funder. I'm still a national funder. And if there was ever a time to work through local channels and through local and community-based foundations, or those that really know their area, this is the time. So when I think about like the big intermediaries, those that have very strong local chapters, that seems like seems like the fastest, smartest way to move right now, given the inability of the rest of us to really understand what those local needs are.
Yeah. And so maybe look into National Domestic Workers Fund. We've been doing some of this at the K-12 level with the NEA Foundation and AFT for the exact same reason. They have some knowledge of what's happening on the ground and the ability to re-grant. So let's close with one last question that I think is related. Barbara, you mentioned field support for grantees. Could you share some examples of what you're doing there and how it can help?
Yeah, I have kind of 5 buckets. Policy advocacy specifically for the reasons we just described, communications, especially reaching specialized populations, technical assistance, professional development and online learning for early childhood and for K-12, and then data and research, meeting data and research needs right now. Those are the main areas I think that we're hearing our grantees wanting to move into.
Really helpful. Shannon, I'm going to flip it to you. We're at the top of the hour. Thank you all so much, and I'm going to flip it to Shannon to close.
So I just want to say thank you all so much. Really appreciate the partnership with GFE and appreciate Barbara and Rian taking time, because it's just crazy on the email with the work. I just want to say we will send out, I've made a list of resources. GFE will help us push back out to you. We have our page up now that we are going to be updating on a regular basis. It's not perfect, but if you go to ecfunders.org, you can do /COVID-19, or there's a rotating carousel where you can see that and click on it. And it's in the chat box. Thank you. And a standing offer that if you want to talk to me or somebody else, mainly I would be connecting you with experts and other funders who might be trying to work on something analogous to what you're working on. ECFC wants to be that resource, right, to all education and early childhood and economic support funders. So a standing offer on my part. And my email is shannon.rudisill@ecfunders.org. We'll send that out to the Be Aware of the volume, and I'll get to you as quick as I can. So thank you so much for the partnership.
Thank you all. Our site is up as well, and you can check that out. And thank you to our panelists. We really appreciate this.
Everybody be well.